I want the goodness in you to thrive. The phenomenon of anxiety, which is not just one thing, there's different depths, levels, styles, presentations of anxiety. Like, just make you nervous, make your heart race, or a deeper level of somatic anxiety can make you go paralyzed or blind. You know, people have this where there's nothing wrong with their ocular nerve or their spine, but they cannot see, they cannot walk, and they're not faking it. There's a depth of a clashing anxiety or dynamic friction or impasse somewhere in the hardware software tree structure that produces these outcomes. If anxiety can make your heart race, can make your vision go blank and get tunnel vision, can make your stomach get super gurgly or you get irritable bowel syndrome, can make cortisol levels stream and cause your blood sugars go super high. You can do all those things. You can do a lot of other stuff too, including making people faint, causing a hysterical blindness, causing an arm to go limp and numb. Um, you can always detect with a practitioner with the right eye who's aware of how the ocean flows, how and what is at hand. Seen many of these cases before, where you do brief psychodynamic therapy, where you kind of you're a little less careful, but you bum rush the ocean and you create an aperture where they're aware of the possibility of how their software ocean psychodynamic currents might be producing this. Example of mother whose son goes off to college, whose grandfather she was super close with went off to something and died in war, had ambivalently attached parents, so her attachment style is loaded with content that she's not even consciously aware of. And then her beloved son, who's a driving, loved, plugged in zone in her life, is leaving. And her son just happens to want to be going into spinal surgery. So all of a sudden, her legs go paralyzed. What's the unconscious goal here? You might be able to see how the ocean flows a little bit. A highly theoretical case example, but this is how it happens. Very real. You can test for it. You can give them a dose of Versed, do a physiological shutdown of certain zones of anxiety. Versed's like Ativan, Valium, Xanax, which I do not recommend because that's powerful magic that leapfrogs the actual structural thing in place at your homeostatic as you are point, which that's where you're going to work from typically. However, you can test. You give them Versed. All of a sudden they can see. All of a sudden they can walk. Or you can hypnotize them, which leapfrogs the anxiety, leapfrogs the defenses or the churn. And in the hypnotized state, they can do the thing. That thing. But the problem is, come out of hypnosis, come off the Versed, that system occurrence goes back to its ongoing state. They become blind and paralyzed again. That is one example of the specialization of anxiety. You know what I mean? Um, that can happen. And I'm fascinated and well versed in the multitude of the layers of the ocean and jungle interaction of how that clash and grind and flow and motivation and interdynamism presents itself. So, especially in anxiety, other widgets of it like OCD, it's like a something deep in the volcanoes causing something on the surface to start whirl around and discharge some sort of deeper internal energy. Um, Go with people with different attachment styles. Found myself interestingly able to conduit with patients who have a narcissistic parent. I can really find interesting uh, ways that feels out in the psychoanalytic relationship as we stay in the living pocket together. Um, just some areas, but many, many others, and broadly trained. I can help your area of need. And I'm not possessive. I don't pretend to be all wise. If something's happening and I know someone else can do a better job or help you more, I want the goodness in you to thrive. I will refer to the greater wizard. I will refer to the person who's going to make the vitality and living thing in you most healthy. That's the most important thing, truly, pretty dang deep in my heart. So like, subscribe. Like, if this helps, if this sounds good and you feel that it's good, um, do the standard like, click, and subscribe. Take care.